Wow, that was a crazy noise. That might have been the loudest ankle pop. Big breath in and then close your mouth.
Oh my god.
You can sit up and stay with her.
Oh my god.
So we have Kim here today, and this is her second visit, but it's the first video, right?
Yeah.
And you came in to see me in my office 2 days ago?
Yeah, 2 days ago.
All right. So what were some of your main concerns 2 days ago?
So my main concerns was really my upper back. I kind of just got out of postpartum, and so I've been dealing with like a lot of tension in my upper back, my neck. I've been having random neck cramps. Like I would look another way and I get a cramp, and also something I've kind of always dealt with, but I never really thought of it as an issue until recently, was in regards to sinuses. So I breathe strongly only through one nose, and then the other nose always tends to get clogged, especially during flu season. So,
Okay, let's go back 1 second before we talk about the nose. How old is your baby?
She's 1 year old.
Oh wow, okay, congratulations.
Thank you.
And have you really felt that tension since pregnancy, or since she was the first couple of, like, it's been consistent,
Yes.
right?
Well, when I guess I would say I felt it after like 7 to 8 months, because all the weight, and then just, I was working also, so just kind of like maneuvering daily life, and also being pregnant definitely took a toll on me. And now being a mom, always having to hold her and just like always having to pick things up is also just like...
Right. And you're a petite woman, you're not a very tall, big woman, so you probably really feel the baby's weight too, right?
Yeah, I do.
Another thing about, my babies are older. My son is 32 and my daughter's 25, but we normally don't hold a baby just like in this, like a weightlifting position, where if you're going to grab a kettlebell, you're under the kettlebell like this.
Yeah.
You don't normally do a baby. A baby, very often you throw your hip out to the side and the baby's sitting here and you're cooking with this hand or grabbing something on the stove. And who would ever, here, look at my hip, who would ever stand like this anyway, right?
Yeah.
Except a mom would, or a dad would that's holding their baby. So it puts our spine in uncomfortable positions for extended periods of time, and that repetitive motion of, I don't want to call it bad posture, but it's the posture necessary to hold a baby, beats up our body and creates long-term chronic achiness, which you have clearly felt at this point. Yeah. And then let's go to the nose now. So we're going to probably do the cranial facial release technique today, and that's the balloon technique that you've seen me do, right? Check each nostril and which side is harder to breathe. So you can hold and hold. Which is the problem side?
This side.
The left side, okay. So let's do this. I'm going to have you lie face down. We're going to start with the regular adjustment.
Okay. Should I take off my sweater?
Yeah, take off your sweater jacket if you don't mind, just because it's really long. And it might catch around your legs when we do the lower back release, okay? So you're going to put your nose right in there. Thank you. And I'm going to put these stretching thing on you, okay? How does that feel?
That's fine.
Good. And you're going to reach out for these handles if you can get them. Good. And that'll add some stretch to it. Now your lower back's not your worst part, right? But I feel a muscle knot here. Do you feel this one?
Yeah. Yeah.
So turn your face this way in case we want to hear you talk about it. Like that you feel, right? Does it hurt a little bit or a lot?
It's a little tense.
Yeah.
Yeah.
All right, let's come up the back. And this whole right side is tight.
Yeah, it is. Okay, right there.
That's a bad spot, right? Are you aware of that? Like one side is always tighter than the other? Like right side
not until recently, actually.
Yeah.
But it makes sense because I can only like sometimes I'll try to crack my back and I can only do it on one side or my neck. The other side is super tense all the time. It's usually this side.
Wow, it's right in there though, right?
Yeah.
All right. So I'm going to do one here. You're going to put your head straight down for a second. Big breath in and blow it out. Got it. Wow.
Mhm.
What did you think of that one?
That was really good. That was super tight right there.
It was right in there.
Mhm.
Let's recheck some of the stuff. So I only did this section right here. And we still have this one to do. Okay. And this one up here too. Do you feel that one?
Yeah. Oh, okay. Yeah. Yeah, that one hurts.
Big breath in and blow it out. Got it. What do you think of that?
Yeah, that was good.
That's good. Now let's do this. Lift this leg up, the right leg, but keep it straight and then lift it like one big piece. So do that on your own. Lift that as high as you can and put it down. And then lift this leg as high as you can and put it down. Which one's harder to lift?
This side.
Again, the right side, right? So let's have you lie on your side that way. So you're going to turn towards me. And you're going to bend just the top knee like this. This one comes up. And we're going to release that spot, okay? So come around this way so you guys can all see this. There you go. We're going to come right in there. Big breath in. And blow it out.
Oh, man.
Got it. Wow, right?
Yeah, that a lot. I felt that.
Good. So lie face down and lift that leg again. So remember, it was the right leg that came up a little more achy. So let's look at that now. What do you think now?
Yeah, it feels looser.
Yeah.
Yeah, way looser.
And let's do the other side, okay? So we still have the other side to get. So you're gonna lie on your side facing me this way, please. Not bad though, right?
No, this is really good.
Big breath in. Blow it out. One more big breath in. Blow it out. Got it. And roll on your back.
You want my back?
No, you're perfect.
Okay.
Okay, I'm gonna be down here. Let's focus on the ankle really close.
Oh.
Well, actually, the hip pulled out.
Oh.
Wow, that was a crazy noise. That might have been the loudest ankle pop of the year for me. Are you okay? You want to walk on that?
That was great.
You want to walk on that and see if it still works?
Yeah, no, I know it still works. It was good. But yeah. You know what's crazy? I had foot pain here. This past
Come
week.
stand up and show me. What were we gonna say?
No, I have foot pain here.
Yeah. Does you feel it now?
No.
All right. Good.
It's good.
So now lie on your back.
Okay.
Did we do the Y strap 2 days ago?
Yes, we did.
Do you want to do that again?
Yes.
All right. So lie on your back. We're gonna do that next. Put your legs down this way. Pick your head up and sweep your hair through, okay? Make sure it's not catching your ears and drop your head because I need the weight of your head to pull it down. No, you can drop everything, but what I mean is as I start to set it up, you can always adjust your ears if you need to, okay? Is it catching anything or is it fine?
It's fine.
And back away just a little bit. Big breath in and blow it out. Big breath in and here we go.
Okay, yeah. That was
How's that
good.
feel? Where'd you
That
feel
was
it?
really good. Right here in the center.
The center?
Yeah.
Did it feel mostly in the neck?
Literally right
Yeah.
here.
Okay, good. So now scoot down a little bit, and you're going to be on the flat part of the table right there, and lie on your back again. We're going to do a little more on the neck. Here, come down a little more. No? There it is. Good. So now come back up on the table, and we're going to do the cranial facial release, okay? So let's give you a few things. I'm going to give you a couple of tissues, okay? I'm going to give you Floppy the dog.
Okay.
So Floppy was my daughter's little doggy when now she's 25, and she donated Floppy to be a support dog for this work. So here,
That's
so look
so
at
sweet.
how nice Floppy is. So you hold on. I'm telling you, you're gonna. If I didn't give you Floppy, you would say, "Why didn't you give me Floppy?"
Okay.
So I'm just getting this ready, and then we're gonna do one. Okay. We're gonna start on. You said the left nostril's not as easy, right? So we're gonna do the. We're gonna do the right nostril first. We're gonna start with the easier of the two. And are you nervous?
Yes, completely nervous.
Yeah. I understand. I was very nervous too. I was nervous for a couple of days. When I first went down to study this, they said we were going to get our first one done on Friday. But something happened and Friday didn't happen, so I had to wait a whole nother day to think about it. And I finally got it on Saturday, and I wound up on Saturday getting like 3 sessions in one day.
Really?
Yeah. And a session is both sides, so I got like 6 balloons in one day, but I was supposed to get like 1 or 2 on Friday as an introduction. The schedule just never happened that way. All right, so we're gonna start on the right side, and you're gonna feel it go in, okay?
Okay.
Oh wait, I have to give you a little thing for behind your head. So here, pick up your head and sweep your hair away a little bit so it fits, and then drop your head back. That'll tilt your head nicely. It helps, right? Okay, here we go.
Okay.
You went in perfect. So what you're gonna do is you're gonna open your mouth, and then when you close it real tight and seal off your lips, and I'll just follow you, okay? Big breath in, and then close your mouth.
Oh my God.
You can sit up and stay with her.
Oh my God. I felt that.
What did you feel?
I felt it like right here.
Did you hear a crack?
Yeah, I heard a crack.
A lot?
It was like, it felt like it was sitting there.
It felt like what?
It felt like it was, that crack was sitting there like for a long time.
Oh, meaning it needed to be cracked for years, right?
Oh
Also
my God.
Get your eye.
Thank you.
What did the sound like?
Like a mini explosion. Oh, God.
Did it hurt or was it uncomfortable?
It was a little uncomfortable.
Yeah.
It did not hurt. But it was just a little bit uncomfortable when you pull it out. I felt the crack. It was intense. It was good.
Yeah. You know, with up on me for a second. So I did one pump and I was not 100% sure if it went all the way through, and I was going to stop there because it felt like it went through, but I wasn't certain, so I let it refill and I did one more pump. Okay. And then it really went through. Yeah. Did you notice that? Like then it exploded through.
Yeah, that's what I felt, like a little explosion.
And I feel if I'm already in there, I want to get it to like really release. Okay. And like you said, it feels like it was stuck for years, right? Yeah. All right, so now we can do the bad side. You ready? Yeah. You got Floppy?
Yeah, all right. I understand.
All right. Sweep your hair away.
Okay.
And we're going to stay with you on the camera. Here I go. Just getting this ready. Let's see. This one's much harder to get in. So I'm going to give a little bit of air into it just to make sure it's in there. Okay, when you're ready, I'll follow you. Big breath in and close it off. We got it.
Oh my god.
Stay with her. Tell us what you think of that one.
That one felt super tight.
It was way different, right?
Oh yeah. Now this one was way easier than this one, for sure. Oh my god, I'm scared for everyone. Yeah.
Did you hear which one was easier?
This one was way easier than this one. This one's
Yeah.
tight. I felt that one. That was super tight.
And did you hear cracking that time?
Not too much. Not too much. But I definitely felt pressure, and I do feel release. Like I feel like there's I feel like slow drainage coming down my nostrils right now.
Yeah.
Yeah.
Are you glad you did it, or you go, why the hell did I do that?
No, I'm actually happy I did that. I'm very happy. Like, oh god. It's like, was this stuff be sitting behind my nose?
Yeah, it was all blocked.
Wow.
Breathe now. Let's see what breathing's like. Any change?
I don't know. I had to get this mucus out my nose first.
All right. Here, give her a second. And she's going to collect herself, so you just be on me for a second. So here's something that the balloon does. One of the things that the balloon does is it mobilizes the cranial bones. It releases direct pressure on the brain by having your bones squeezed so tight in your face. It relieves the dural meningeal tension. And the dura is like the sac or sheath on top of our brain and spinal cord. So it releases some of the pressure around that. And think of the casing on a hot dog being too tight. And we sometimes feel that way where, like our brain and our skull is just too tight. It definitely opens breathing passageways. It will facilitate sinus drainage. And some of the people that would come for something like this have breathing problems, migraine headaches, sinusitis, tinnitus, which is the sound in your ears, like the whooshing or ringing, vertigo, Bell's palsy, trigeminal neuralgia, sleep apnea, snoring, head trauma. And it helps a whole bunch of different things for people. But we don't really target curing any disease or ailment. And now we're back. So, what do you think overall?
It was good. Really good. I liked it.
What was your favorite part of today's treatment? Y strap.
The Y strap, but definitely the CFR was definitely very, very different, and I really liked it. I'll definitely come back for it.
Some people describe it as water going in the nose. Do you
That's
think?
how I felt.
Really?
Yeah.
Okay.
Yeah, I felt like definitely something going in the nose and then mini explosion. But
Okay.
other than that, that's good.
All right.
Now I just feel like super runny nose right now.
All right. Thank you. Now you brought your friend Anna here, so we're gonna see her video next.
Okay.
All right.
Thank you.
Bye bye. We got it.